You're on thyroid medication, or your mom had thyroid cancer, and you're wondering if that means a GLP-1, semaglutide, and tirzepatide is off the table for you. Here's the honest answer. Some of what you've been told about your thyroid and these medications is a hard stop. Most of it isn't. I'm going to tell you which is which. There is one real hard stop on these labels, and I'll have it for you in 30 seconds. Because it's almost certainly not yours, then the correction nobody bothers to make. Then number 3, everybody assumes a slower stomach means your thyroid pill gets absorbed less. For one form of these medications, they actually measured it. It went the other way. This is educational, not medical advice. And nothing in the next 9 minutes is a reason to change a dose on your own. I should also tell you, I run a practice that treats people with these medications, so you know exactly where I'm coming from. And this warning, I read it, thought about it, and accepted it for my own body. Let's start with the hard stop. The warning on the box is real, and I'm not going to soften it. The heading says, risk of thyroid C-cell tumors. The contraindication underneath it is one sentence: a personal or family history of medullary thyroid carcinoma, or a syndrome called MEN2. That's the whole list. 2 things get missed there every week, and both sit on the word family. 1, family history counts. Your own thyroid can be perfectly normal. If your mother or your brother had medullary thyroid cancer, it's still a no. That's the one place in this entire conversation where the answer is really no. 2, thyroid cancer runs in my family is not enough information. Most thyroid cancer is papillary, and papillary is not the one in the warning. Somebody has to find out which kind. Call your aunt, get the actual word. But here's what usually gets left out. That warning came out of rodent studies. Rats and mice, lifelong exposures. Whether it applies to humans, in the FDA's own word, has not been determined. And no, the FDA has not removed that warning, narrowed it, or reviewed it anyway. It's on every one of these labels right now. Half of you are thinking, fine, but does it cause thyroid cancer in people? 2 much bigger studies went looking for it. One of them with 2.5 million patients. Neither found it. European regulators reviewed the whole pile, and it did not find evidence for a causal link. Follow-up is short, so I'm not telling you it's 0. I'm telling you that unless medullary thyroid cancer in your history or your family's, that warning is not the reason you're being told no. So what did I do? I read the warning. I asked the same family history question I just told you to ask. And then I made a call for my body with my history, knowing I'd be checking labs and not guessing. That was my decision. It isn't a recommendation for yours. What I'd actually recommend is the boring part. Know your family history and keep checking your TSH. Quick thing, if you're already learning something, hit subscribe. I put one of these out every week. Back to it. So that's the hard stop. Now the correction, and it takes 4 seconds to check. I went through all 7 of these labels: Ozempic, Wegovy, Mounjaro, Zepbound. The tablets. Hypothyroidism is not a contraindication on a single one of them. Neither is Hashimoto's, not one. Here's why. The precise version, the tumor in that warning, comes from parafollicular C cells, a small, separate population of cells scattered inside the thyroid. Hashimoto's is your immune system attacking the follicular tissues, the part that makes the thyroid hormone. Different cells, different disease. The 5-year-old version, same building, different tenant. The warning is about one small office on the 3rd floor. Hashimoto's is down the lobby. Sharing an address doesn't make them the same thing. One more thing, because I actually find it encouraging, Hashimoto's is an autoimmune disease. Your own immune system attacking your thyroid, separately from anything about the boxed warning. These medications have real, documented anti-inflammatory effects. They lower inflammatory markers like CRP, and they calm some of the same immune signaling involved in autoimmune conditions. There's an active emerging body of research specifically looking for GLP-1s in autoimmune thyroid disease right now. But I want to be straight with you. No trial has proven that these medications improve Hashimoto's or lower your thyroid antibodies. It's a real open research question, not a settled one. What is settled, it's not a contraindication, and for the right patient, it can be part of a much bigger metabolic picture. Okay, number 3, the one I told you to stay for, and I think it's being taught backwards. Everybody assumes this. These medications slow your stomach down. That's not a side effect. That's the mechanism. So slower stomach, less absorption, your thyroid pill stops working. Makes total sense. It's what I'd have guessed. They measured it. It went the other way. In the drug interaction study printed on the label from the tablet form of semaglutide, the pill, not the shot, levothyroxine exposure was increased by 33%, not decreased, increased. Precise version, total levothyroxine exposure over time went up 33% when levothyroxine was taken alongside semaglutide tablets. Plain version, a slower stomach doesn't mean less. The pill sits there longer and more of it gets across. Same pill, more of it lands. And I want to be extremely clear because this is the easiest thing in the video to misquote that 33% is the tablet. It comes from the oral semaglutide label. It's not a general GLP-1 effect, and I'm not claiming it is. The injectable label says something different, that in clinical pharmacology trials, semaglutide did not affect the absorption of orally administered medication to any clinical relevant degree. And here's the tell. No injectable label names levothyroxine at all. Only the tablets do. On a shot, that numbers is not yours. Because here's the line. This whole video turns on. The danger isn't that your thyroid pill stops working. It's that it starts working too well. And there are 2 different roads to that. On the tablet, it's absorption. For everybody, shot included, it's the weight coming off. And look, sort out which of these you're on, what your labs are doing, whether your plan even fits your thyroid. That isn't something you should have to piece together from YouTube videos. What I'll point to you at the end. Hold that thought. But here's the road that's about everybody. Your thyroid dose was set for the body you had. The body is about to change, and nobody moves the dose. So what? A little extra thyroid hormone? Who cares? Too much thyroid hormone speeds the heart, thin bones over years, destabilizes the heart electrical rhythm, specifically atrial fibrillation. In December, a study came out, Medicare data, everybody on a stable thyroid dose, starting either a GLP-1 or a different diabetes medication, GLP-1 group had percent higher rate of atrial fibrillation. The author's explanation is exactly where we've been heading. As the weight come off, the thyroid dose that was right for you stops being right, and nobody rechecked it. Now here are the limits, because they matter. That was observational, an association, not proof of cause. In older adults with diabetes, average age around 73, is not a reason to be afraid of the medication. It's a reason to get a lab drawn. If you're 40 and healthy, that number isn't about you. What you do about it is the same. And here's the gap. A second study in March asked one question. Are people on GLP-1s getting their thyroid hormone checked more often, given their doses more likely to need changing? No. Testing was identical to the comparison group. Missed opportunities for timely weight-responsive thyroid monitoring. In the author's words, the gap is why I made this video. If your thyroid was removed or ablated, a case published in April, someone whose thyroid had been removed, stable 5 years on the same dose, started tirzepatide. By 6 months, their TSH was undetectable. A healthy thyroid buffers a small shift. Yours can't. So the whole ask in one sentence: as you lose weight, ask your prescriber to check your TSH. This is a conversation with your primary doctor or your endocrinologist, who's ever actually managing that number, not something you self-manage. Suggest rechecking within the first few months, but that's your own doctor's call, not mine. And then, don't touch the dose. You get the lab. They move the dial. Don't touch the dose is the rule on the GLP-1 side, and it's the rule on the thyroid side too. And separately from all that, there's a short list where you don't wait for a lab. You get seen. A new lump or swelling in your neck, a hoarseness that doesn't go away, trouble swallowing, any of those on these medications or on none of them, that's an in-person evaluation. Now, not a message, not a next month. When someone with a thyroid condition sits down in front of me, I get this all the time, here and in my practice. People on thyroid medication asking if semaglutide is safe. Here's exactly what I do. I want your last labs, your TSH, your T3, T4. If it's stable and there's nothing else going on, you're going to be able to start. Same with Hashimoto's. If you're on thyroid hormone or anything else for it, and you've been stable, and if you got an endocrinologist or primary who's comfortable managing it, I have no issues. I'll check your labs too, or work directly with your doctor to keep everything in sync. Now, medullary thyroid cancer, I hardly ever see it, once in a blue moon, but when I do, that's something I cannot allow. Nobody can. Same for men too. A family history is a no. Otherwise, these medications are safe and effective, and they do a lot more than just help you lose weight. Once your labs are checked, you're seeing your doctor regularly, and all of that is cleared, you're good to go. That's why it matters to have someone go over your personal and family history before you start. If they're not asking, that's a red flag. Don't go with them or some online company that doesn't know what they're doing. The only real hard stop is medullary thyroid cancer or men too, in you or in your family's history. As the weight comes off, ask your prescriber to recheck your TSH and don't touch the dose yourself. And the neck lump, the hoarseness, the trouble swallowing, that's an in-person visit, not a video visit. Take it to your next appointment. Because here's what I want you to walk away with. Your thyroid is not a reason you can't take this. It's a reason to keep checking. If you got a thyroid condition and you were told this medication isn't for you, and now you're not so sure that was ever true, that's the kind of thing I help people work through. The link in my description has more information on how to get started. It will walk you through whether this is even a fit for you. If you're on Instagram, comment GLP-1, that's GLP-1 on any of my posts at GLP-1 Dr. Lee, and I'll get you pointed in the right direction. And tell me in the comments, if you're on thyroid medication, did anyone ever explain how it fits with this? Or did you just get a no? I read every comment, and your answers become the next video. And hit subscribe. I put a new one out every week. I'm Dr. Lee, and I'll see you in the next one.